think we're ready to start. So welcome to this early morning press conference. This is for the truly dedicated. Today we're going to talk about the expansion of the Global Gag Rule and the future of US global health policy. I'm Françoise Girard, the president of the International Women's Health Coalition, and I'm very glad to welcome all of you to this session. We have with us Vanessa Rios, next to me on my immediate left, who is our program officer in our Learning, Monitoring, and Evaluation program at the International Women's Health Coalition. Next to her is Jade Maina, who is the executive director of TICA in Kenya, an organization working on women's rights and women's health. And at the far left, we have Carol Sekimpi, who's the country director at Mary Stopes, Uganda. So welcome.
Thank you.
Good morning. So we're very proud this morning at the International Women's Health Coalition to be able to present to you this report, Crisis in Care, which is a report that documents the second year of impacts of the Global Gag Rule in 4 countries, Kenya, South Africa, Nigeria, and Nepal. We at the International Women's Health Coalition have for 35 years advocated for the sexual and reproductive health and rights of women and girls around the world, together with many feminist organizations. We're ourselves a feminist group, and we've worked very closely, for example, with TICA in Kenya, and have supported them financially as well as with technical assistance. Briefly, the Global Gag Rule, I think many of you know what this is about, but it's a policy first enacted by President Ronald Reagan in 1984 and reinstated by every Republican president since. In fact, this is something that President Trump did, one of his very first actions when he came into office in January 2017, was to not only reinstate the Global Gag Rule, but actually expand it greatly. And what it does is attach conditions to US global health funding given to foreign civil society organizations. And what the conditions are is that any organization, foreign non-governmental organization that receives US global health assistance is prohibited from providing abortions, counseling on abortions, referring for abortions, having any information about abortion in a clinic or a facility, and advocating for abortion, speaking out publicly in democratic debates in their own country on this topic. This is the case even if they have separate funding from another donor to cover those activities. So as you can see, it seeks to affect the entire field of health and to demonize and stigmatize abortion across the board. At this point, it affects $9 billion a year of US global health assistance, which is a great expansion. And it's obviously shaping an entire field of global health as a result. And as we will see, it is extremely detrimental to women's rights and women's health and women's equality. So this is the second year we collected the data. So I'm going to turn it over to Vanessa, who's going to explain how we conducted this research in the second year. And then I'm going to ask her a couple questions about the findings.
Great. So in the last 2 years, IWHC and our partners in Kenya, TICA, Nepal, Nigeria, and South Africa have conducted more than 170 interviews and collected irrefutable evidence that the Global Gag Rule is depriving women, girls, and other marginalized populations of essential health information and services. The policy forces clinic closures and exacerbates existing barriers in care. This affects not only abortion services, but also makes HIV/AIDS testing and treatment, maternal and child health care, and services for survivors of gender-based violence and other services harder to access. In rural and remote areas where people may have to travel hundreds of miles to a clinic closure can be devastating. In the words of a director of an organization working to improve access to health services in rural areas of South Africa, when the US pulls out and an organization closes down services, it's not just the abortion services. It's the information to women, it's HIV services, it's pregnancy services, and it's always the most poor and marginalized who suffer the most.
Thank you. And Vanessa, what were, in the research that you carried out in the 4 countries with the partners, what were some of the most surprising findings of this research?
Right. So I think the fact that the policy is really undermining government's abilities to drive health policies and priorities. In South Africa and Nepal, the Global Gag Rule directly contradicts the country's progressive abortion laws and undermines efforts to expand access. In Nepal, the policy forced the early termination of a health system strengthening project aimed at ensuring that reproductive health commodities could get into remote and hard-to-reach areas in 11 districts that the government itself had prioritized. Mm-hmm. In South Africa, where the national curriculum for life skills-based education is under development, civil society organizations are supporting the government as technical experts. Because many of these organizations are funded by the US government and are prevented from providing information about abortion, interviewees from both civil society and the government agencies involved shared that it was all but guaranteed that abortion would be excluded from the national curriculum. And this is in a country with a constitutionally guaranteed right to access to healthcare services, including reproductive health care.
Yes, so it is, even though governments are exempt from the global gag rule, they are in fact, as you found out, affected in the provision of services and information and education.
Absolutely. And another interview that was conducted with a public health nurse in South Africa found that it's really affecting referrals to public services as well. So non-governmental organizations are the ones that often provide information and referrals to the freely available public services, and those are in decline as well.
So across the 4 countries, real damage to health services and real damage to women's health. Jade, can you tell us a bit about what you found when you carried out the research in Kenya specifically? What were the top findings for you?
So for me, the top findings...
No, adjust the mic. Yeah.
For me, the top findings of the research was the fear and the misinterpretation and over-implementation of the gag rule. There was a lot of lack of knowledge from organizations that were supposed to be implementing the gag rule that did not even know the exceptions that there were for provision of services, especially when the life of the mother is in danger, or for access to post-abortion care. So some organizations did completely gag themselves to the extent that they provided no services, including post-abortion care. Some of them put even signs that say no abortion services are provided here. What we have seen is that this has then heightened stigma around abortion and access to reproductive health services. It has led to the fragmentations of services, while before there was the need to and a drive towards integrating services and making comprehensive facilities for all reproductive health services. This has now meant that reproductive health services are fragmented and women have to go to multiple places to access comprehensive reproductive services. The thing about it affecting the most marginalized communities, we have seen the most marginalized communities in our context being young girls who, I would say one example where an affiliate of IPPF that provides services in Kenya and provided free services for adolescent girls now can no longer provide free services, have had to shut down some of their facilities, which ends up being that all services, including services for malaria, TB, HIV, can no longer be accessed by those communities that they were serving before. A sex worker organization that was interviewed before, they did have trainings on safe abortion. Now they can no longer do that. They cannot even refer women for these services. Another sex worker organization that we work with also reported that they have just completed a study that showed that the #1 killer of sex workers in Kenya is unsafe abortion. Every month they see at least 35 women die of unsafe abortions. So I would say that we see that more marginalized women are the ones who are dying, and this gag rule does exactly the opposite of what it's supposed to be doing, which is protecting life. And also we see that while it's supposed to be curtailing abortions, it's actually riding up the number of abortions that are needed by women, because access to contraception is also a problem.
Thank you, Jade. And did you, I
Yeah.
see that Vanessa wants to jump in. Go ahead.
I wanted to add just to what Jade was saying, because there was a really striking example of this happening in Kenya. We spoke with a director of an organization that serves primarily sex workers, LGBTQI people, and other young women. And they described how before the policy, they were able to work with the local MSI affiliate to provide information and referrals about safe abortion. Now, because they can't provide that information or referrals anymore, 2 girls formerly in their care died from attempting to self-induce abortions using unsafe methods. And that's one example that we got, but our interviews also included other anecdotal evidence that preventable deaths and complications from unsafe abortions are increasing among certain populations because of this decreased access to comprehensive health information, to contraceptives, and to abortion services.
Thank you. Carol, you are in Uganda. You're with Mary Stopes International. That is one of the organizations that, at the global level, refused to sign on to the Global Gag Rule and therefore lost a significant amount of funding. Can you tell us how the Global Gag Rule has impacted your organization at the global level and also specifically in Uganda?
Okay, thank you. So as she said, Mary Stopes will not sign up on the MCP. And in 2017, this led to a loss of 17% of our annual donor income as an organization globally. And although several donors have stepped in and tried to fill the gap, MSI still retains a gap of up to $15 million worth of funding through 2019 to 2020. And this continues to have a devastating impact on the world's most vulnerable women and girls. As a direct result of this, an estimated 1.4 million women and girls globally will lose access to MSI services and care by 2020. And this will result in an estimated 1.8 million unintended pregnancies, 600,000 unsafe abortions, and 4,600 maternal deaths. At country levels, the countries most hit are Madagascar, which had to close their voucher program that was reaching up to 170,000 women annually with contraceptive services. In Uganda, we had to close 5 outreach teams, and these are teams which move in deep rural, hard-to-reach areas to provide contraceptive services to women and girls. And in Zimbabwe, we had to reduce the number of community outreach sites by half, from 1,200 to 600. More important, beyond the loss of funding, is the chilling effect of the Global Gag Rule. It's one thing to turn funding on and off, but to rebuild the bridges that are broken as a result of a Global Gag Rule is more difficult and will take a longer time. We see emboldening of the opposition. It is legitimized. It is connected in high places. They have a very targeted approach, and they are causing significant disruption to service delivery. In Malawi, there's a petition against Mary Stopes for provision of abortion services. In Uganda, they have an active anti-choice caucus in the parliament, and this is blocking progression on sexual reproductive health and rights. We see a bit of isolation. Partners who previously worked with us have come and asked us to step aside, because if they work with Mary Stopes, then they risk losing the funding that they desperately need. We see huge resistance and bureaucracy to development and implementation of policies to guide service delivery in the broader context. There's a lot of unnecessary debate about comprehensive sex education. The conversation on guidelines for sexual and reproductive health has been unnecessarily protracted. And all of this is ingrained in the emboldening of the opposition and legitimizing the debate against sexual reproductive health and rights.
Jade, I wonder if you could add to that, because you've also seen in Kenya an upsurge in right-wing activity and anti-abortion activity recently, including attempts to shut down the Mary Stopes Clinic. Do you want to say something about how the emboldenment of regressive actors is playing out in Kenya as a result?
In the last 1 year, we've seen the most activity of the anti-choice, and I think our situation mirrors very much what's happening across the globe and in Uganda. For example, towards the end of 2018, we did see a petition to the government to shut down all Mary Stopes services, including post-abortion care, including life-saving services. There was an uproar from pro-choice organizations, and the ban was lifted towards like in December on the 20th. In January, we saw billboards go up with information about shut down abortion clinics, abortion is murder, of course, very stigmatizing messages for women and girls who need abortions. We have seen such an increase of activity, including marches and picketing in front of abortion facilities, which sometimes are actually health facilities that provide a wide range of reproductive health services, making it very hard for women to go in and access services that are very much needed. The petitions keep on going, especially even for people who are prominent and are supportive of sexual and reproductive health in parliament or in our leadership. So there is a lot of attack on social media of organizations that work in these ways, and the fragmentation of coalitions. Organizations that have signed on to the gag rule feel that they cannot be able to come into meetings that would be able to strategize to mitigate the harmful effects of the gag rule.
So at this point, I would like to open it up to questions from the press. I assume we have some people in the room who might want to ask questions. Yes, and please identify yourself as you do so. Thank you.
Hi, I'm Anna Santos. I'm a reporter from the Philippines. My question is about the safety of the healthcare workers. Have you experienced, or have any of the health workers reported experiencing harassment and intimidation, physical, not just social media, as a result of the gag rule for those health workers who are working in abortion-related facilities or providing abortion care? Thank you.
Carol,
Yes.
you able to speak to that?
Yes, we see more intimidation and threats to our staff. In Uganda, we've had 2 incidents. We had an uncalled for arrest for a provider who was talking to people about how to deliver post-abortion care. We have had gunmen visit one of our clinics and take in a provider and ask them for inside information. Sometimes they disguise as government, sometimes they come up front as opposition. It's difficult to tell which one is what from the other, but we do see that the safety of providers is compromised.
Just to add on to that, in our context, we see a lot of harassment of providers, and most of the time the law enforcement agents will be sometimes seeking bribes, which becomes very difficult to keep operating and sometimes drives the prices of the services high.
Yeah. And have you seen all of this really increase since over the last 2 years in the context of the global gag rule then?
Yes, definitely. Every time there is anything published either on the media with a highlight of the supposed illegality of abortion, there is a heightened harassment of providers, which either leads to them shutting down their own facilities or them being shut down by harassment, especially from harassment of police.
Yes.
Hi there.
Yes.
Hi, I'm Khomotso Matsugane from South Africa, KFM. And as you know, abortion is legal, but yet 50% of all abortions in South Africa are still illegal because of stigma. How do we start addressing the issue of stigma in a very effective way? Because part of what the gag rule has done is that you get now people who call themselves conscientious objectors working in the field. it's almost like they've been given a new language. That language wasn't there 5 years ago at all. So how do we start counteracting some of the language around it, and particularly the stigma? Is there any insight as to how we address the issue of stigma?
Yeah. Vanessa, I think you can speak to some of the research, the findings in South Africa of how this is playing out.
Yeah, I think this, the global gag rule is definitely exacerbating the stigma. Conscientious objection did come up a lot in our interviews, and we don't have the data to say that it has increased as a result of this policy, but certainly the purpose of this policy is to stigmatize organizations that advocate and provide abortion services. So I think that is another serious impact of the policy in a place where it's legal but not necessarily accessible. And I think a major concern that came out of the interviews in South Africa is that there are still low levels of understanding of the CTOB Act, and there are organizations that are doing good work to try and educate, but some of those have been gagged even before the implementation of the policy. And this is speaking to the chilling effect. Even before the policy went into implementation, there were examples of organizations that were removing even just the mention of the South African law from their materials because they knew that a Republican president was in office. This policy is going to come back, and therefore we're preemptively taking the information out. And there was a lot of, frankly, just anger and frustration that a US government policy could prevent people in South Africa from just knowing their own laws.
Mm-hmm. Mm-hmm. Yes.
Hi, I'm Sarah from the UK. Throughout this conference, we've had a lot about the rollback of rights, like Justin Trudeau was talking about it. It's been mentioned a lot by various different politicians. But I just wonder if you think that they should be using more explicit language and directly raising the global gag rule, because I feel like lots of the mentions and criticisms are quite veiled. Do you think that's helpful? Do you think that world leaders should be more direct in criticising the global gag rule?
Maybe we could answer this because one of the questions that we examined through the research was whether or not governments in country were speaking up, to actually call out the global gag rule as an interference, a foreign policy, interference into their own national policy. So we have some interesting findings on that.
Yeah, so overall, across most of the countries, when we did interviews with government officials, there were very low levels of understanding of the policy and what it entailed. The policy itself doesn't apply directly to government agencies and multilateral institutions. However, as I mentioned before, what we see in practice is that it really is affecting government services, it's infiltrating government policies, and I think it's really important for all of us to help draw those connections and bring those to light so that governments can also speak out about the impact that this policy is having on their population.
But inasmuch as they've been given an opportunity to denounce the global gag rule, what did we find in terms of whether national governments, the governments of Kenya, South Africa, Nigeria, or Nepal, were really speaking up on this?
We haven't really seen them speak up on this. I think the only place it did show up was in a couple of interviews with government departments in South Africa, just how egregious and neo-colonial this policy is, and really trying to force a regressive ideology on another country through this policy.
Yeah. And in Kenya and Uganda, Carol?
My observation is that most of our countries in sub-Saharan Africa are largely donor-dependent. And the US government is one of the biggest funders of most of our country programs, beyond health, development, the politics, the road construction, and all of that. And so when you are dependent like that as a country, you don't necessarily have the luxury to think for yourself. And this is the dilemma in which our governments find themselves. So they may have a belief on the one hand, but they have to keep their funders satisfied. And this is what they juggle with every day. And we see that even if they may not close down Mary Stops, for example, then they will ask you to be a bit harsh about your operation so that they can maintain the peace. Our governments are really in a difficult position where either they need to find more domestic funding for them to be able to drive their agenda, or they need to find alternative funders to be able to manage that balance. But for as long as the US government is the biggest supporter of government operations, then the luxury to do what they think is right is not tenable.
For us, we found that the Ministry of Health, first of all, does not agree that this affects health services, and says that because it does not affect the funding directly to government, then they do not see why they should be talking about it. It was actually very hard to even secure an interview, and they kept on bouncing back and forth from, this is the office you should be interviewing, this is the person you should be asking these questions. At the very end, they just say, no, this does not affect us at all, which is not true, because a large percentage of services are provided, A, directly by donor funds to the government, B, largely by faith-based organizations and civil society organizations that are now affected by the Global Gag Rule. So it is definitely affecting health services in Kenya.
So not only are they not denying, they're not denouncing, they're even denying that there's been an impact.
Yeah.
I have one more thought to add. Yeah. So what we did hear when we spoke with representatives from the government was that it's really important for them to hear from civil society. It's really important for them to get information about what the real needs are. And this policy is silencing, is gagging the organizations that will speak about abortion, will speak about, the sexual and reproductive health needs of their populations in meetings. And so that goes back to our earlier conversation about really amplifying the voices of the right-wing, the regressive actors. They are receiving increased funding while organizations that are really advocating for sexual and reproductive health and rights are either losing their funding and therefore not able to participate in those spaces anymore, or they're being left out of those spaces because other organizations won't be there if abortion is on the agenda, just in very many ways, it's really just silencing those voices while at the same time emboldening the more regressive voices in the country.
And the question Sarah was getting at was also about other donors, whether or not they should be more vocal on this policy. If I may jump in, there has been some, movement with the She Decides movement, for example, to speak up on the question of the global gag rule, but yes, I think they could be more vocal, but also I think the funding that's been made available is not going to be able to make up the difference, right? The size, the absolute size of the US Global Health Assistance budget is such that even with additional announcements like what we heard from Canada this week, it's not at all, of the same magnitude. So $9 billion annually from the US in global health assistance. What Canada announced, for example, in sexual and reproductive health is an additional 300 million Canadian a year. The 1.4 billion is actually only an additional 300 million a year from what they're already doing. So it's not going to make up the difference, obviously. So that's the reality we're facing. We're going to need to take other measures to deal with the situation.
Hi, I'm Linda Giftash from NBC News in London. My question is fairly simple, and I've had a few other people I've asked this to that sort of dance around it a little bit more, so I'm hoping maybe you can be quite direct about it. But would you say lives are being lost, women are dying, young girls are dying because of this rule?
Yes, absolutely, they are. As I spoke about earlier, we had the example of those two young women in Kenya who died directly as a result of this policy. Reading the interview was heartbreaking because you could see the director really struggling. You know, she has the information. She knows where she could send people if they needed abortion services. And because of this policy, was prevented from doing so. And these two women died. And that was, our interviews were conducted about almost a year ago. And so to think of what has happened since then, and just the number of preventable deaths that have happened as a result of this policy is really staggering.
Juliet, I think you already mentioned the number of young sex workers who've been affected.
So this organization, it's called KESWA, Kenya Sex Workers Alliance, has just concluded its report, which is after the gag rule findings were already in the report, and they found that over 35 women die each month out of unsafe abortions. And you do realize that the biggest organization that does sex worker rights organizing in Kenya has been gagged. So it can be shown that it's a clear direct impact from the gag rule.
Carol?
Just how we think about the way it works out to the point when a woman dies is you have the global gag rule, we have loss of funding, there's less access to contraception, there are more unplanned pregnancies, there's more stigma, there's more fear, means more unsafe abortion and more maternal death. That's how it spans out. And even if you have these documented deaths, there's a lot more that we haven't documented yet. Women are dying as a result of the GGR.
I also want to add that we have these cases of women dying from unsafe abortion, but the policy really impacts so many different kinds of services. HIV treatment and testing. There was an example of another organization in Kenya that lost funding, had to close down a clinic, and therefore couldn't continue providing services for 13,000 orphans and for vulnerable children living with HIV. So it's these examples like that shows that it's not just unsafe abortion, but we're really contributing to deaths and preventable illnesses in other ways that will be even more difficult to measure.
Thank you all. I'm being asked to wrap up. Thank you for your attention. I urge you to take a look at the report. It is really rich. The information is quite incredible. As I read it myself, I just was shocked by the extent of the harm, the damage, the disregard for women's rights and women's health that is at the root of this policy. And please stand with us. Thank you.